The room is buzzing with doctors and nurses running and shouting across the ER room. The world seems to be spinning and everything doesn't seem to be real. Hospitals are hectic and crazy at times, especially during emergencies. During these stressful times, it can be easy to freeze, but doctors and nurses have to be able to communicate fluently with each other to make sure the patient gets all the medical attention that he or she needs. Many never think of it, but one of the biggest reasons that hospitals run so smoothly is because of good communication skills. I believe that communication studies matter and makes a difference in the daily lives of a nurse. Being a good nurse, it is important that you have a great communication skills and are able to connect with patients and other healthcare professionals to help build relationships, prevent medical mistakes, and give a level of high-quality care. During stressful times, it is essential that you communicate, otherwise it could lead to mistakes. And mistakes in the healthcare field usually lead to death. According to the Journal of Patient Safety in 2013 by Marshall Allen, 440,000 people die each year from preventable medical errors, and 80% of that is from miscommunication. Another big part of communication in nursing is making sure the patient feels comfortable, safe, and being able to ask them questions kindly and without scaring them. According to the Time Money online website in 2014 by Kara Bradesky, 1 in 3 Americans are afraid to go to the doctor, so being friendly and kind to patients is a huge skill that nurses have to have. Some people with nosocomophobia, or a fear of hospitals, say that they do not want to visit hospitals because they do not think that they would ever get out of there alive. Being a nurse, you have to adjust to people like this and communicate with them with a gentle voice because they could easily be scared away. Nurses also have to be good listeners. Patients can be a wide range of types of people, so nurses have to be able to communicate with quiet, wild, or psychotic people. But being a good listener can help these people trust you and feel safe to talk to you. Patients give out important details on their status that should be recorded and used to diagnose and treat. But sometimes these things are not always said directly, so listening is huge. According to Nurse Together online website in 2016 by Marian Johnson, listening is important to nursing for 3 main reasons: better understanding of patient condition, psychological reasons, and prevention of other or worse conditions. I believe that communication studies matter and make a difference in the daily lives of a nurse. Nurses are dealing with sick and injured patients every day, and some of these patients can be very hard to communicate with. And being a nurse, you have to find the best way to communicate with them kindly.